Welcome to TKC Smart Design Series. Today what I'm going to discuss is the all-on 4, all-on 6 treatment. Now this is a very popular treatment which many patients are coming in asking about and having done. So I'm going to go through some of these cases and just kind of underline how we do it, since it's something we do quite a lot of, and I'll just go through one or two cases to emphasize what we're looking for and the sort of questions you may have in your head which can be answered by this. So if we look on this case, so we say all on X simply because it depends on number of implants. Some people put 4 implants, some people put 6 implants, some people put more implants. In general, the minimum number of implants you need for an upper or lower full arch treatment is 4, but you can potentially have as many as is possible and necessary. So you can have 6 or 8 implants. It just depends on what the clinician feels is adequate and also what sort of bone you have. So I'm going to go through one or two cases and kind of emphasize what we're looking for and how we go about doing this. So this is a case that I'm going to discuss in quite a bit of detail because in this situation the patient has got pre-existing gum disease, hence why you can see the recession of the gums. I mean, once upon a time the gums were all the way down here, so they've receded because she's undergone a lot of gum treatments in the past to try and improve her gum condition. And actually, if you look at this, her gum condition is actually really good in the sense of the gums are really nice and pink, so I can see that they're really well looked after. But the issue here is on radiographic examination, there's very little bone structure holding these teeth in position and they're now quite mobile. So the question is, what do you do in this case? Do you carry on doing gum treatment until they fall out, or do you say, well, actually we now need to think about doing something which is going to improve the cosmetic and functional condition for this person? So this is why it's a good case to discuss, because it's not immediately obvious that these teeth need to be removed, but the bone support was less than 20% on most of them, so they were very mobile. And the issue is, if you literally wait for these teeth to fall out, there is literally no more bone left in either the maxilla or the mandible to place implants, and that's one of the biggest issues with having all on 4, all on 6 treatment on patients which have had pre-existing gum disease. People who have had pre-existing gum disease poses us a lot of challenges because of the amount of bone that's actually present. So in this case, it was decided upon, with obviously going through all the details of the patient, to actually go ahead and do this process now. So what we went ahead and did is we decided to remove all the top teeth, place 6 implants on the top, and on the lower jaw we'd actually place 6 implants as well, because the bone was adequate and it was good. So what we did, we placed those implants. We had a surgeon come in and place some specialist implants right at the back of the mouth. When the bone quality is not good, you're able to put some implants in the pterygoid area, which are a different type of implant, but they give great stability. So we were able to do those, and on the same day have everything made so that the patient walked out with a provisional prosthesis. So the provisional prosthesis is something that looks like this. So this is just made as an immediate, immediately, so someone's able to walk away with it. So these specialist implants are only able to be done by specialist surgeons. So these type of implants, we have a specialist surgeon who comes in and places them. And the key thing for these pterygoid implants is that they give you an option where you don't have great bones near the front of the mouth. So that's something that we're able to do. The other option, if there isn't great bone, is to look at zygomatic implants. And again, those implants are very specialist implants, and only very specialist surgeons place them. Other options people consider is bone grafting. Problem with bone grafting in doing these type of treatments is you have to wait minimum 6 months for that bone graft to take, and the treatment plan becomes very, very long and drawn out. So where possible, we try and avoid that in our cases. Bone grafting cases are very unpredictable as well, and they just take a long time. So if it's possible to place the implants by placing pterygoid zygomatics, etc., and then loading them so you walk away with a prosthesis, a fixed prosthesis straight away, we would always try to do that, because that's what patients want. Nobody wants to have a bone graft and wait 6 to 9 months with a denture or nothing there for everything to heal, because that's what you have to do. So in this case, we were able to take all the teeth out, even though there were some infections, etc., place the implants, clean everything, place these implants in the non-infected sites, so you do not want to place implants in an infected site, and then provide a prosthesis which looks decent. I mean, this is a decent looking prosthesis as an immediate. And then once everything is healed after 3 months, this is screwed in, so it's not a denture, this is screwed in. This gives you an idea of what these prostheses look like. This is the final prosthesis actually made, but the difference in these type of prostheses that we provide is in that the ceramic work is really fantastic, and each tooth is individually made. So with the temporary prostheses, I don't know if you can see here, but everything is kind of monotone, one color. It's all milled from one block of PMMA, which is an acrylic. And that's effectively what the person uses as a temporary. However, with the final ceramics, we are able to provide a prosthesis like this one on the left, where each tooth is individually made on a framework. And if you look here, it looks very natural. And this is sent to our labs, and they're able to make a really beautiful ceramic prostheses, and the gum is all beautifully made in a resin, so it just looks super lifelike. And I think in these cases for patients, they just want to be able to have teeth that look supernatural, and I think we've achieved it in this particular case on the top. So you can see here how these teeth actually look. Now that is the final prosthesis. Now that to me doesn't even look like a prosthesis, that just looks like someone's natural teeth. So I think this is where the difference is in the actual end result for patients, is the actual prosthesis that you provide. When you provide a ceramic one, which is individually made, so the teeth are basically individually placed, it just looks supernatural and obviously very beautiful. It doesn't stain, it has great longevity, and you know, in this case the patient was very happy. We matched a photo from when the person was much younger and didn't have the gum disease, and actually were able to provide pretty much the same smile. So it's a really nice case to showcase. And the other thing you can see here is, you know, we've got translucency underneath these. I mean, this just looks like natural teeth, but they're very translucent. It's a really nice end result, and that's, I think, what separates people when they're doing these all-on X treatments, is how good is the end result, how natural is it. Obviously longevity is important, but the final aesthetics is what people come in for. So, you know, as long as you're able to provide good longevity, but then a very beautiful end prosthesis, I think that's what you would look out for. So this is a really nice case to showcase, and it's not a case where the mouth was totally mutilated with decay. This was a case where somebody just had gum disease and was unfortunate that the gum disease really destroyed the bone structure around the teeth. And yeah, this is the end result, before and after. So yeah, I'm very happy with this case.